I really just don't even know what to say. That has been so powerful, extraordinarily powerful. I'm practically tearful myself listening to those stories. And I think that in raising our awareness for SCAD, and the meeting's already officially over right now, but I can't think of anything that more powerfully would have been able to give that message than our survivors that just shared their stories with us. That's just enormously huge. So while I recollect myself for a moment here, it's very, very powerful. I'm going to share in a larger sphere what is out there in the community and in the global community for people to become more aware. And I think that you're all aware that there are two large organizations, and you've probably all researched this and found out about SCAD Research and SCAD Alliance. And each of those organizations were developed by patients with SCAD. One of them you've met earlier today. Thank you so much, Catherine Leon. Or a family member of someone who unfortunately was not a survivor of SCAD. And that's SCAD Research, which established that way, and that is Bob Alico, whose wife passed away from a SCAD heart attack. And he established a large organization to be able to look more into understanding this effort. And while I was at Mayo, he actually, through the organization of this group, was able to sign over substantial checks to be able to promote some of the research that you've seen presented repetitively every time we saw Marisha Tweet's name. That had to do with this advocacy that he established. And similarly has happened here in Canada, in Vancouver. Then, of course, there are professional advocacy groups for awareness of SCAD, and our own American College of Cardiology has made efforts to increase awareness. Each of us individually involved with that have done that as well. Within Canada, the Heart and Stroke Foundation has specific pages on their website that address SCAD. And they have community groups, community survivors, of which some of the groups you've already heard about today and new ones are spawning all the time in different regions in Canada, so that our patients with SCAD can reach out and support each other and be able to continue to increase the awareness. What I heard from our stories was that there was shock in each situation, except for maybe our one patient who already had FMD and was just waiting for the shoe to drop. You shared very beautifully with us, Erin. But our other patients, and most patients that I have met, are completely shocked because they generally aren't expecting this, obviously. But there comes an acceptance, and that acceptance then leads to being able to help others. And I'm always amazed at the women, mostly women that I have seen with SCAD, are also erudite, eloquent, and capable in their own individual lives. And so the ability to share that awareness is really, really stemming from the grassroots up, and that's huge. So this is how I would just summarize it in my mind as a physician, that there are advocacy groups that are enormously empowered to be able to improve that awareness. But it comes from a cost to each of you individually that participate in that. It's all volunteer, and it's all passion. And for those of us that are all here, it's Saturday on a Labor Day weekend. We all are very much really passionate and committed to being able to help and move this forward. And then activities and fundraisers for research, very important. And the bling, the fun part. We got to have fun, right? If we don't have fun, that's what we have to be able to balance with. So the bling, the swag, and then giving the nuggets of information. Like Dr. Saw said, I love algorithms. I've tried to be a mother according to algorithms. It doesn't work. So it's nice to have algorithms in work, right? But we can share those algorithms and those information sheets, and we can share them at all levels. And we can share them through all types of media. Social media is huge. Now, there are dangers because it can become overwhelming, and so we have to know what our own limits and set limits in that. But sharing stories I think that is the absolutely most powerful thing. Whether you do that through nuggets on social media and make the decision to do that, or whether you do it in your communities through TV, radio, news bulletins, or in your neighbor, next door, while you're out, mowing your lawn or in the grocery store. Sharing and being a champion. That's what it's all really important to do. And then our responsibility as healthcare providers and researchers are to be able to further the mission to understand what's going on, do research, and to publish it. And my hat is off to Dr. Saw and her team, who have enormously published, as well as Dr. Hayes and her team. So wonderful. And then partnering with industry is also important, because there's not so much a specific thing, but certainly technical things that are used in the diagnosis of SCAD. It's an angiographic diagnosis. Our industry partners can actually also improve the education and awareness amongst our colleagues. So just a quick, I have this all basically in some pictures. So those are the websites, you can find them. The SCAD Alliance, the SCAD Research websites, the professional websites. The UBC has very informative, lots of information there, as well as the Mayo Clinic website. And we need to recognize that we're kind of in a bit of an echo chamber here, and I came from an institution where there were all kinds of opportunities and resources. I'm in a different situation now, and I have seen this with different eyes, and that's why being together and bonding together and doing things nationally, and we have a huge, I think, a bit of an advantage actually in comparison to in the States, where there are many more cats to herd. Here we have fewer cats to herd, and we can actually get on the same page about what we're doing. And I think that that is a unique opportunity. Events, to have fun opportunities. We're going to have one here today, but it started in the States, the concept with the skedaddle. I love these words too, scadsters, skedaddles. I mean, all those are very, very sweet. Wasn't here last year, but I'm looking forward to seeing this in action very soon. The swag, bonding. Making, and that increases awareness, doesn't it? People, you'll be in the grocery store. What is SCAD Strong? I've heard of Boston Strong. I've heard of, all these other Strongs. But what is it? These are ways to get the message out in subliminal ways. And then bonk, sledgehammer ways, here are pieces of information. And what I found very interestingly, and I didn't actually know this until I looked it up a little bit on the website, but that there's a different approach for each target audience. And so the public audience, the EMTs, and I'm going to tell you about a very special EMT in the Toronto area who has just taken it to another level, and physicians. So it's important to target information in making awareness about SCAD to the different audiences that we have. Mayo's done a really nice job with infographics. This is one that these are screenshots from my smartphone, actually. I just pulled it off, taking the screenshots when I saw a really nice infographic that Mayo Clinic put out on Twitter. And the reach you can get with this information to increase awareness is huge. And the specific statement was about being aware in the peripartum period. Sharing stories, here's the SCAD Alliance one. This is a woman who was in Ottawa, and her story went across CBC. CBC is like NPR, Sharon, okay? So it's, who didn't say within the last week, I heard on CBC radio, because, it's everywhere, obviously, for us, and it gives us a lot of information for Pam, too, so you know what I mean about CBC when we say NPR. Okay. So, and then our Facebook groups, using social media as a platform to be able to garner peer support and increase more awareness. And the therapeutic aspect of that too, but just increasing awareness of what to expect and what to share and how to do. And then each, beyond the national situation, or institutional, it's been amazing to see all of these groups pop up and be developed, but it does take quite a bit of work. I'm going to tell you a little story about the Nova Scotia SCAD support group. There are about 20 or 30 members right now. And there's a particular individual that organized it just last year, and Catherine Cook is her name, and I'm going to tell you a little story about her in just a moment. But first, a story that I found out about my good friend, Kristen. Kristen O'Mara, because she's totally public about this, and I worked together for my entire career at Mayo because she was a nurse and a sonographer, and I spent a lot of time in the Echo Lab. But more than that, we both liked to run, but we weren't runners, and our daughters were also soccer teams and together, and so it was just a whole round experience. And so we ended up, we ran Chicago Marathon together and Boston together, and we did, we didn't run Boston. She qualified at a different time than I did, but whatever. We ran Chicago together. That was totally bonding, and we always were Saturday morning runs, would see each other. And then I'm back in Nova Scotia now, and I see this, and actually I saw on Facebook that she's in the hospital with a SCAD event, and Dr. Tweet had diagnosed her in the ED when she came in because she had developed chest pain while she was on the treadmill over our Rochester Athletic Club. And I'm going I was totally in shock. This was, about a year and a half ago? Yeah. And it was just amazing to me. She took this in the way that she would, like many of you have, and turned it into an opportunity to increase further. Even at Mayo Clinic, where we already seem to know a lot about SCAD, she increased it even further. And she went and wrote her whole story, started a blog basically about what had happened to her and to increase further experience. And so the message came out at that point that her key message was to physicians: if you see a young healthy woman who is coming in with a heart attack and has no or minimal risk factors, basically not a smoker, then until proven otherwise, she has SCAD. And you must respect what she's saying. You must listen to her symptoms, even if they sound a little bit odd and different. The social media to the max. This is the EMT I want to tell you about in York, just a suburb north of Toronto. This is Christina Alessandro. She's an amazing woman who I met at the Canadian Cardiovascular Congress a couple of years ago. And she's a paramedic, and she's so passionate about women and heart disease. And she actually wrote a grant to be able to get funding to make a movie called Atypical Heart. And if none of you have seen this, I would advise you, please look it up. You can access it. It is extremely powerful. And there are, if not one or two SCAD patients who tell their stories in this. And this needs to be spread around. Are you one of these patients?
I am.
I thought you might be.
I'm doing a presentation.
Could you please introduce?
I'm Lori Blakely, and we're doing a presentation in Victoria on a week from today. So if anyone's, I can't remember the rest of the details, but ask me if anyone is interested afterwards.
Thank you so much, Lori. And in Victoria also, of course, is this woman who's featured in the center here, Carolyn Thomas. And Carolyn Thomas, she did not have SCAD, but she had a difficult time getting her heart attack issue and her coronary disease issues diagnosed quite a few years ago. And she is a very motivated individual. She actually came to our Science and Leadership Symposium at Mayo Clinic, and she took the education and the blogging on her heartsisters.org to another level. She's a writer and an HR person, again, a very accomplished professional and not in medical arena, but has applied all of her skill set to increasing the awareness for heart disease. And so Carolyn has supported Christina significantly, and as you can see, the comments about her blog, they're supported by everyone, and she's in Victoria, so you must know her as well, Lori, right?
I have not met her yet.
You haven't met Carolyn? Okay, so tell her I say hi, please, when you see her. So anyway, and then SCAD Research then tweets about the video that has been released with this information. So this is all getting out there. Millions of people have access to getting this information because not everybody can be with us in this room today, right? So Awareness Weeks, this is sponsored by the SCAD Research, and they're the ones that generated those information sheets. They have suggestions. So those are SCAD focus groups. What about increasing awareness within our larger groups that we have? And so for almost 2 decades now, we've been trying to increase awareness of heart disease in women. And so you can see some of the groups that have been organized. There are campaigns that have been developed. Thank gosh that Heart and Stroke reinvigorated their campaign that they had in the early 2000s, and they've come out and rebranded this as Time to See Red, and there certainly is a component of SCAD education in there. So I'd encourage all of you to become involved also with heart and stroke if you're looking for an opportunity. From the professional and patient advocate viewpoint, we put together the Canadian Women's Heart Health Alliance, which was born out of a summit that occurred first in Ottawa in 2006, and then we had the follow-up summit in 2018. And this Canadian Women's Heart Health Alliance was developed because we knew that we need to do something to move the needle forward to improve outcomes for cardiovascular disease in women in Canada. And certainly SCAD awareness is a significant component of that. So we have these 4 working groups. Dr. Tara Sedlak, who you met yesterday, is the chair of the advocacy working group. I'm the chair of the knowledge translation and mobilization group. And Dr. Abramson is education and training, and Dr. Colleen Norris is the health systems and policy. So within that, we have actually established a Wear Red Canada Day, which is a bit patterned off of the Wear Red Day that I was familiar with in the US for many years, and the Go Red movement. And we had this successfully across Canada, and you were on the site. We also saw lots of pictures that came out, and I didn't put all of the pictures in here, but this is where I had the opportunity to meet up with Catherine Cook, whom I mentioned earlier. And Catherine, we did, I can't tell you, countless TV and radio media events leading up to Wear Red Canada Day. So this is encouraging everyone to be able to do the same thing within these contexts, take it to the next level. She told her story at our event that we had, and she came with her family. Actually, that's her daughter, Tova, and shared with the group who you see is on the stairs, and we posted everybody across Canada in the centre so we could get this to be able to be an event on the calendars to occur. And she told very detailed story, the usual thing about a SCAD patient, done everything right, but I still got a heart attack, you know. So this is very powerful. This spreads big messages. And that little picture in the middle, that was what Tova drew. That is a picture of her mom, how a heart should be, and how her mom's heart was on the day that she went into the hospital with her heart attack. And that had been about 2 years earlier. And she's really grown herself. So Tova herself, her daughter, helps spread the story and increase awareness, right? So as physicians and healthcare providers, what we can do is we can do CME. We have to do as many CMEs, particularly in smaller communities. I can't tell you how many times I've gone to smaller communities and given talks about heart disease in women, and of course SCAD is always, very prominently features and things that we have to think about. And also, don't miss the F&D when you're screening, and we also get a lot of patients that get transferred, or they get referred into us for consultation after we established our Women's Heart Health Clinic in October 2017. This is an article that appeared, I found this online actually, so it's having the visibility with industry idea, but this is important because at meetings, national meetings, these folks go around and they need to interview people. They interview people, we need to talk about things, we can give specific information, and then that gets a whole other audience. It extends out the reach even further. So, in summary, what can I do to increase SCAD awareness? I think of it as kind of 2 columns here, me or you that are with us, our survivors, our patients, or their loved ones, their families, or me and us, the healthcare providers. Certainly sharing stories as a survivor, it's enormously powerful. We can't emphasize that enough. Peer support groups, and then looking for training. I just intrinsically, how everyone's so talented at being able to get on a podium and talk and do things. You blow me away all the time, our survivors. It's incredible. Not everybody maybe feels that way, so there are opportunities for training and groups like the Mayo Science and Leadership Symposium, and I don't know if we could develop something like this in Canada, but I would love to see us get a similar program going. On the healthcare provider side, certainly share CME, volunteer, give talks, talk to your colleagues, make sure that you know that there's a women's heart clinic available where the SCAD patients can be appropriately managed. and be able to establish cardiac rehab programs that are important, and partner with your patients. It's huge, extremely important to have that healthcare provider and patient, woman or man with lived experience team. We're all a team, healthcare team with the patients in the center of that team, as Dr. Wood said earlier today. So that's really all that I have to say, except to add that activities are really important. So we're going to go for that run and that walk, and I hope to see you all there later this afternoon, and thank you very much for all the participation.